The world of virtual, augmented, and mixed reality is here, and the possible applications for its use are growing. You're probably familiar with it in the world of gaming, but what about within your hospital? I'm Katie Coyle, and this story tonight on 5 Minutes. Today we are here with mixed reality engineer Boubacar Diallo to give an idea of what the new frontier in immersive workspaces means for healthcare.
Hi, Katie. Immersive workspaces allow users to feel a sense of reality. This is possible with the use of virtual, augmented, and mixed reality. With all the pressures that come when working in the medical field, institutions are beginning to use augmented, mixed, and virtual reality as a part of learning in order to improve care and reduce medical errors. Virtual reality implies a complete immersion of a digital experience that shuts out the physical world. Using VR devices, users can be transported into a number of real-world and imagined environments. Augmented reality is an overlay of digital content on a real-world environment. Virtual objects can be in various forms: images, videos, or interactive data. Mixed reality is a fusion of a physical world and a virtual reality. Mixed reality starts with a physical space and places a virtual object within it. Users are able to interact with these objects with the use of headphones, goggles, and gloves. In the medical field, immersive workspaces can create a new world for medical training, procedures, ultrasounds, and accurate diagnostics. AR, VR, and MR can simulate real-life events, thus reducing future traumatic events for medical practitioners, as opposed to the traditional way of diagnostics and training.
As you can see, this innovation is bringing information off the paper and into the working environment. So how exactly could this be implemented in a hospital? Jared Zimmerman, Health Services Manager at St. Jude's Children's Hospital, can tell us more.
Here at St. Jude's, you may be surprised to find out we're not new to mixed reality. We use mixed reality assist for everything from fundraising to pain management. As part of the VR for Good initiative, we've partnered with Oculus and Facebook to create our Hall of Heroes, which creates an island hopping experience for patients to interact with 60-foot tall courageous survivors and their families. But it's not just about lifting up our spirits of our patients. Pain management department uses mixed reality to treat acute pain management in sickle cell anemia patients. But now it's really time to take mixed reality to the next level and apply it to better treat our patients. We should approach mixed reality in really two key areas. The first one is educating patients and healthcare professionals. Educating patients in a creative and fun way helps them and their families better understand and prepare what to expect when they go through surgery. Next, for our healthcare professionals, the best way to really explain mixed reality as an educational tool is to look at an industry leader in mixed reality, and that's Stanford University and Lucile Packard Children's Hospital, where Dr. David Axelrod actually teaches the complexity of the heart using alternate reality. The second area we should focus is as a surgical tool and training. As the saying goes, practice makes perfect. Fighter pilots train for hundreds of hours in simulators. Why should training for complex surgery be any different? In 2018, Children's National in Washington, D.C. received such a system to assist with surgery, and their CEO, Kurt Newman, said it perfectly at the time. This technology should translate into better outcomes. The system they received, Precision VR by Surgical Theater, which was developed by former fighter pilot and simulator experts in the military.
So what benefits and even risks lie within this technology? Dr. Alex McAleer from St. Jude's is here to enlighten us.
The major benefit with having this type of technology is the immersive experience, which puts everything into focus and puts you in the middle of the action. You become more keenly aware of what is going on, and I think that is special when it comes to this kind of technology. I like to think that there's a sense of realism to it, and it keeps you tuned in and focused. However, in regards to the risk, we must be made aware of the limitations that come with this type of technology. For one, and I think it is essentially important to note that we are, of course, human, and everything that we do behind the scenes rather is a mystery, and we can't come into a situation knowing exactly what the result would be. Say, a surgical procedure. Communication is key, plain and simple. We need to set ourselves apart from the rest of the medical centers like us here at St. Jude. A lot of what we do, sadly, is hardware driven, and we can't rely solely on that being the saving force. At the end of the day, we have to ask ourselves, what are we doing differently, and is our work making a valuable difference? In this case, that difference affects our patients and our medical professionals. To conclude with this one last thought, we need to keep up with the advancement of technology, because tomorrow we might have something totally brand new and different, and we'll have to adjust to that change accordingly.
The world of healthcare is a centuries-old industry, yet with the integration of various realities and the work at St. Jude's, we can see that the innovation will never stop. Thank you for tuning in. We'll see you next time.